I have a great guest with me today, and I've brought the expert on nutritional testing, vitamin testing, mineral testing. I have Kirsten, who's a master in nutrition and our Western Division trainer with SpectraCell Laboratories, in the studio with me today, and we're going to be answering all your questions about what type of vitamin testing, what type of mineral testing, and nutrients that people should be concerned about. Welcome, Kirsten.
Thank you, Dr. Thomas. Good to be here.
All right, Kirsten. So we've had a lot of conversation. You spend a lot of time in my office. We talked last week about nutrients and vitamin deficiencies and all this marketing that's out there. And you can walk down any aisle of a health food store and see what marketing does. Are you tired? Can't sleep? And it's so common for the consumer just to see that and be desperate for help and pick up that nutrient supplement. And, last week we talked about some of the things that are in these nutrients. We had our listeners pick up a bottle of fish oil, and we talked to them about poking the capsule, having it squeeze out. I got so many calls last week about the rancid smell in people's fish oil. I had people call in the office.
Fish all day long, right?
Exactly. So we talked about kind of the quality of vitamins, what people should be looking for out there. And now today we want to talk about how you shouldn't just go out there, walk down the aisle, pick a supplement to take because you're tired, you can't sleep at night, you got that foggy memory out there. Even depression, anxiety, people are searching for answers and become desperate to have anything that can help them out there. So this is a great testing that's done. We say test, take out the guessing. This test actually looks at specific nutrients and vitamins and really customizes a vitamin plan for our listeners out there. So I want to talk a little bit about different types of testing. It's common for the consumer not to know what type of testing to go have done. They think they can go in to traditional family practice, internal medicine, at your local laboratory here, have your testing done, but that's not always the answer out there. I have people even come in and say, I had my B12 tested, I had my folate tested, and everything's normal. Well, there's so much more in nutrients and vitamins out there that you don't want to just look at the simple ones that people hear, because oftentimes it's a cascade. And I always say at my practice, the whole body works together. It's not just your hormones. It's just not your nutrition. You're not going to lose weight, have energy, feel good, or get rid of that foggy brain by just fixing one thing. Right. It's kind of like a car. It's got to all be fixed to work together. So I want to exactly. So I want to talk a little bit about the testing with SpectraCell Laboratories and how it's different than going and getting a traditional blood test done.
All right. Well, we really are looking at individualized medicine, which I think is the real push for most people. It's not a one size fits all. And so SpectraCell testing, what we do with our MicroNutrient test, the flagship of what we do, is looking at 34 different analytes intracellularly. So that's different than what you might get if you go to get a red blood cell folate or even a 25-hydroxyvitamin D. We are able to assess within that concert that you were talking about and within that multitude of interactions and reactions, what exactly is insufficient or functionally deficient. We're not talking about a primary vitamin deficiency. We're not talking about beriberi or scurvy, although you can have some people who've had bariatric bypass surgery where this can exist. But by and largely here in this place in this world, we're not talking about primary vitamin deficiencies. We were talking more like of a triage theory, sort of Bruce Ames style, and he's a researcher who's been around at University of Berkeley for a long time, who has come up with a triage theory saying that your body will sacrifice long-term gain and long-term health to make sure that you are stabilized today. So if your pH of your blood is not right, if it's off, you're going to leach calcium. And if you're not getting calcium from your diet, you're going to take calcium from the bones. And when you do that for the long term, what are you going to have? Osteopenia and osteoporosis. You're going to have side effects of lower bone density. So what we're looking at is to optimize the values as it relates to symptoms. People are coming to you for what? Fatigue, right?
And sleep problems. We live in this 24-hour town full of stress. People have anxiety. We see it even in their cortisol levels. And I've talked about this even on other shows, how abnormal cortisol levels, it was great with all the marketing out there, got lots of commercials on the TV, take cortisol blockers, you'll lose weight. Well, if there was a fix, we'd all be skinny. We'd never have to worry about losing weight. We could just take a pill, take green tea, and all these commercials out there that have just really confused people on what to take and what not to take out there.